Here we are going to discussions few question category commonly asked in NCLEX board. So pharmacology and parental therapies, about 15% question come in NCLEX board. And pharmacology including adverse effect, contraindication, side effect, and inter-drug interaction, blood and blood product, central venous access device, dose calculation, expected action and outcome, medication administration, parental and intravenous therapy, pharmacological pain management, and total parental nutrition. So one example of pharmacological question. The home health nurse is going to start IV with 5% dextrose in water for 76-year-old women to perform a venipuncture. The nurse should start the IV which of the following. So first of all, when we see any question like this, it is good to find out the keyword. The home health nurse is going to start IV with 5% dextrose. For my patient is 76 years old. And to perform the venipuncture, the nurse should start IV with which of the following? Number one, the veins of the client's wrist on non-dominant side, let's say, and the veins of leg, so it will not interfere with the client's ability to feed herself. The dorsal vein of the client forearms on a non-dominant side. So, and also dorsal surface of the client hand in a non-dominant. So usually we follow the dorsal vein of the client forearms on a non-dominant. So why number one is not an answer? They say the vein of the client's wrist. Actually, we use the forearms, not in the wrist. Why not wrist? Because wrist is used for the pulse. We check the pulse here. Forearms is good choice. Why not number 4 is answered? Because dorsal surface of the client hand, but we need the veins for IV, intravenous. So this is the reason we choose number 3 is the answer. Because dorsal vein, but here nothing talk about the veins. Forearms, not in the wrist. And also, we always prefer non-dominant side. It is good for my patient. So now let me go to the next discussion. They said the correct answer is 3, and this is the best side for the nurse to use IV because it is the ease of access. It is easy to access, and also availability of elastic veins, limited use of the client. And you will, they said, you will learn more about the content covered the physiological integrity or pharmacological or prenatal therapy. So physiological integrity is always coordinate with pharmacology. Another subcategory question we will get from reduction of risk potential, which account for 12% questions in NCLEX code. So this is the other subcategory we will get the question in NCLEX code. So nursing action that are covered in reduction of the risk potential include change in abdominal vital sign. It is covered up to this. Change and abnormalities of vital sign, diagnostic test, laboratory values, potential for alteration in the body system, potential for application of diagnostic test, potential for complication of surgical procedure, systemic specific assessment, and also therapeutic procedure. It is included in the risk potential. So here an example of risk potential. Let me read it here. 7-year-old girl with type 1 insulin-dependent diabetes mellitus and has been at home sick for several days and is brought to the emergency department by her parents. If the child is experiencing ketoacidosis, the nurse should expect to see which of the following lab result. So this patient have a diabetes, right? It is the known patient was diagnosed by diabetes mellitus, and also I said it's a known case, and patient is 7 years old. So what type of diabetes is most common? If patient is 7 years old, it would be type 1 diabetes, right? Not type 2. Type 2 is more common in adult person. So what are the keyword? 7 years old, type 1 diabetes, and it is basically insulin dependent, but type 2 is non-insulin dependent and has been homesick several days and brought to the emergency department by parents if the child experiencing ketoacidosis. So ketoacidosis, we call diabetic ketoacidosis or DKA. This is the complication of type 1 diabetics. But type 2 diabetics complications are called hyperglycemic hyperosmolar non-ketotic coma, shortly called HHNK, type 2. But type 1 is DKA, right? So if patient have a DKA, means my patient blood sugar level will be so high. So the nurse should expect to see which of the following lab results. So this question not talking about the sign and symptom of the disease. The person who have a ketoacidosis, it will be more common. They have a rapid and deep shortness of breath, and it is called Kussmaul respiration. And Kussmaul respiration question frequently come in NCLEX board. If you go to close to the patient, you can get a breath odor, then it is called fruity bread smell due to the acetone. And another question sometimes NCLEX board asks, if the patient has a diabetic ketoacidosis, what type of metabolic change occur? It is metabolic is called metabolic acidosis. Metabolic acidosis, right? Like a patient has a diarrhea, also metabolic acidosis. If a patient has a vomiting, metabolic alkalosis, right? So what about the insulin, blood sugar level? Serum blood glucose 140, or serum creatinine 5.2, serum blood pH is 7.28, and hematocrit 38%. So first of all, we sure it is not an answer, because we are talking about the diabetics. We are thinking about the glucose, hematocrit for volume of red blood cell, which is related to anemia or hemoglobin concentration. Like serum creatinine, this is the function of liver function test, sorry, kidney function test. If my kidney doesn't work well, the creatinine level will go up. No, now I have to think serum glucose maybe 140, or I can think the blood pH, because I said metabolic change occurred, and it is called metabolic acidosis, right? If patient complication of the diabetic ketoacidosis, it is more common metabolic acidosis. So the normal pH 7.35 to 7.45. Let me write it. I said normal pH should be 7.35 to 7.45, but it is less than 7.35 means acidosis, and diabetic ketoacidosis, metabolic acidosis is occurred. So you can say this one pH supposed to be 7.28, because my patient has a DKA. And if patient has a why DKA? Because patient is diagnosed by type 1 diabetes mellitus, because patient is 7 years old, right? Not adult. And type 1 diabetes mellitus is called, complication is called DKA. If patient has adult and type 2 diabetes mellitus, complication is called HHNK, means hyperglycemic hyperosmolar non-ketotic coma. This is the complication of type 2, but DKA complication of type 1. When a patient has a DKA, patient pH concentration go down and metabolic acidosis occur. It is the complication. When we understand the metabolic acidosis, when the pH level less than 7.35, here, metabolic acidosis also occur in diarrhea. But in vomiting, we can say metabolic alkalosis. Common question NCLEX board asks. And why number 1 is not an answer? Because blood glucose 140 milligram per DL is not that much higher, patient can develop the DKA or complication can start. Usually blood glucose level if more than 135 or 126, we call hyperglycemic condition, but not that much complication start when it is look like this. And also remember, in case of type 1, which is called insulin dependent diabetes, most prevalence in children and non-obese adult. And there is a little or no insulin production by the beta cell or islets of Langerhans in pancreas. But type 2 diabetes most common in obese person, adult person, usually older than 40 years of age. And there is a partial decrease of insulin production and or cell resistance to the insulin. What next? Next question, they said normal blood pH is 7.35 to 7.45 and blood pH 7.28 indicate patient develop diabetic ketoacidosis. More is the patient develop metabolic acidosis. Another type of question, NCLEX products. The fourth categories of this in NCLEX board, we get the question from physical adaptation, because there are 8 category questions we will get in NCLEX board, which account for 30% of question in an exam. So nursing action that are covered in this subcategory include physiological adaptation, include alteration the body system. Like a patient is older, their body system is not like in young adult person body systems. Fluid and electrolyte imbalance, super duper important for NCLEX board. Also, it is so easy if you know how to read, how to make it easy. So also hemodynamics, illness management, medical emergencies, pathophysiology of the disease, on unexpected response in the therapy. So the physiological adaptation can cover all of them. Here we go, an example of question about physiological adaptation. So question example, physiological adaptation subcategory. Question, the nurse deliver external cardiac compression to the client while performing cardiopulmonary resuscitation. CPR, very important, right? So if you want to work as a healthcare provider, you have to have the CPR card. So which of the following action by the nurse choose? Which is the best one? So external cardiac compression to a client while performing cardiopulmonary resuscitation. So number one, they said so here I said number one, what we do, maintain the position. First of all, maintain the position and close to the client side with the nursing knees apart. Number 2, maintain the vertical pressure on the client's chest through the heel of the nurse hands and recheck the nurse hand position after or every 10 chest compression and check the return the client's pulse after every 8 breath by the nurse. So this is the correct answer is number 2. Maintain vertical pressure on the client's chest through the heel of the nurse hand. Heel. So the nurse elbow should be locked, arms straight, with the shoulder directly over hands. Incorrect pressure or improperly placed hand could cause injury to the client. So if I explain step-by-step process of CPR, what are the first steps? Our first steps, call 911 and ask someone else for the help. Then lay down the person on their back and open the airway. We have to check the airway, and we tell the patient, or we help the patient to lay down on their back. Then if they are not breathing, we check my patient have a breathing or not. If no breathing, we start CPR. Usually, when we start it, it is 30 chest compression and also to rescue breath. And finally, we check patient get it back the breath, or when we can repeat until the ambulance or AED arrives, right? We have to go for the step-by-step process. So this is in step-by-step process. When we start the CPR, always maintain the vertical pressure on the client's chest through the heel of the nurse hand. So it is the part to start CPR or 30 chest compression. What are the next category question? They said it's called nursing process. Here also we'll get the question from nursing process. So several processes are integrated throughout the NCLEX exam. The most important are nursing process. So nursing process involve assessment, analysis, planning, implementation, evaluation of nursing care. So I said nursing process is very important. When we go for the prioritization question and answer, if you do not know the nursing process, it would be really difficult for you to answer. So they said the nursing process basically involved here assessment, analysis, planning, implementation. So easy way to remember: assessment, then analysis, planning, implementation, and evaluation, right? So easy way to remember, I said it PI5, A for assessment, D for diagnosis, P for planning, I for implementation, and E for evaluation, right? So easy way. So sometimes NCLEX board asks, which are the second steps of nursing process? What are the last steps of nursing process? You have to answer. First of all, I said A for assessment, right? What does it mean, assessment? We check our patient, we look our patient, ask the question, monitor your patient, or inspect, right? Everything we have to do. Usually assessment is done primarily by RN. RN is supposed to do this. But LPN must understand this process because the LPN collect the data. A critical role is the assessment. LPN must know this. The type of data to be collected here, during the assessment, I said, we take the history, objective data, subjective data, or data collected from the chart, which is called secondary data. Objective data means what you observe or measurable, like vital sign. Subjective data means symptoms experienced by the client. So when you get the data, confirm the data collection and also communication about information received for the assessment. And number two, I said analysis or diagnosis. It is called nursing diagnosis, or it is called analysis, right? So analysis means identify the actual or potential healthcare needs and or problem based on your assessment. Also interpret the data. What does it mean? It does mean validate the data. What is validate? Validate data means patient saying something, but you are during the examine or history taking, you feel something wrong, something suspicious. It is more common in psychiatry unit, or organize or determine if there is a need for more data collection. And also in this phase, the nurse uses data to formulate, right? And also it is the part of our nursing diagnosis. And then we have to go for planning. Planning means, and planning before planning, and this is done to provide the client care consistently or appropriately. We ask the following question to the patient. What question will be asked? When you make the patient planning of care, we ask what are the priorities for a patient and how does this determine the client needs. So when you're making the plan, we follow the priorities, we follow the client's needs, because every patient needs is not same. And also we have to ask, how will this affect the care of the client getting better? During the planning, you have to keep this note in our mind. And during the planning, we determine the goals or formulate the outcome criteria. We develop a plan of care and collaborate with other healthcare professionals. And it is called interdisciplinary approach. Then we go for implementation or intervention. Keep in mind, implementation or intervention, it begins to do something and then to doing. So first of all, for implementation, we need to prepare. Prepare for what? Means any organ, what the patient do, what are the planning, we have to follow the well-organized way. So organize the client's care. We gather all equipment, also explain the procedure to the patient. It is a part of implementation. Then we go for the counseling and teach the patient. So counseling or education direct to the client and their family members, also significant others or other member of the healthcare in the team. Implementation, we have to do some perform. So we follow the procedure, infection control, we follow the guideline and monitor the client's response of care. And after care is performed, we make the client comfortable and then replace any equipment no longer needed. Whatever we do, we keep the record. So documentation is important and document everything accurately. Also, it is important to know the LPN report the findings to RN and RN report abnormal findings to the doctors or healthcare provider. And last steps is here, it is called evaluation, right? E. So evaluation has the need been met, right? Also compare the actual outcome with expected outcome and re-evaluate the problem list with the rest of healthcare team. It is the very basic for the patient about the nursing process. And now let me see what they said about assessment. Assessment is the first steps of nursing process. It involves establishing and verify the database of information about the client. So you can identify actual and potential health problem. The nurse obtained subjective data and objective data. Also, this data is collected by interviewing or observing the client and significant others, reviewing the health history, performing the physical examination, and evaluate lab results. Also, interaction with members of healthcare team. Here is the one example of assessment. Example of assessment test question. Let me explain. The nurse obtained health history from a client admitted with the acute glomerulonephritis that is associated with beta hemolytic streptococci. The nurse expected which of the following to be significant in the health history. So, question, the keyword first. The nurse obtained history acute glomerulonephritis, right? So inside the kidney, we can see, if you go to the anatomy of the structure of the kidney, we can see the glomerulus, So if any antigen antibody reaction occur and inflammation occur of the glomerulus, it is called glomerulonephritis. Glomerulonephritis, if not treated well, they can lead to the chronic kidney disease, and chronic kidney disease lead to the renal failure, and patient need dialysis. So it is very important to take care of the patient who have glomerulonephritis or nephritis. So our patient has an acute condition suddenly attacked by glomerulonephritis. So glomerulonephritis sometimes is more common to the children who is attacked by beta hemolytic streptococci. Basically, patient give a history of the sore throat. And if you do not identify the pathogen, if you do not give them antibiotics, or you gave the antibiotics, but unfortunately my patient did not take it an adequate doses and duration, this beta hemolytic streptococci go through the blood to the kidney, and they are antigen, and antigen when go inside the body, antibody is produced, and antigen antibody reaction occur. Antigen antibody reaction occur. This antigen antibody reaction cause antigen antibody complex, and this is occur in glomerulonephritis. In the glomerulus inside the kidney, it is work like a filter, so many pores, but this antigen antibody complex blocking the filter or hole, and the waste product are not allowed to passing through the glomerulus, and creatinine level go up. So the nurse expected which of the following significant health history. The client has a sore throat 3 weeks early. I said the problem starts from sore throat, fever, no antibiotics, bacteria go to the kidney and started the problem. So answer is number 3. So number 1, this is 1. So sore throat start. There's a family history of glomerulonephritis. It is not mandatory. The client has a renal calculi. So renal stone, calculus totally different things than glomerulonephritis, very unlike. Renal stone, if you do not remove, if it is a complication, causes the UTI, urinary tract infection, if not treated, UTI lead to the pyelonephritis, and pyelonephritis is untreated for a long time, they can cause glomerulonephritis, but very late stage. Number 4, the client had an accident involved in the renal trauma several years ago, but my patient is acute, means give the history less than 3 months, not for the 7 years. So correct answer is a glomerulonephritis is an immunological disorder, antigen antibody, or it is called immunological, that is caused by beta hemolytic streptococci. It occurs 21 days after the respiratory or skin infection. It is more common in the children who have a impetigo. If impetigo does not treat well, it leads to glomerulonephritis. Analysis. During the analysis phase of the nursing process, you examine the data that you obtain during the assessment phase. This allows you to analyze and draw conclusion about the health problem. During analysis, you should compare the client findings with what is normal. From analysis, you establish nursing diagnosis. The nursing diagnosis is an actual or potential health problem. That is, the nurse is licensed or managed. So you see, it is nursing diagnosis. It is not doctor's diagnosis. What are the difference between nursing and doctor diagnosis? Imagine a patient came to the hospital because of fever for 10 days. Only fever for 10 days. We call fever for unknown origin. Unknown origin. But I said, when a patient comes to me as a RN, I will welcome them, take the history, I make a note, and I have to write the diagnosis without any laboratory test. Maybe fever because of underlying cause, but we do not know at the beginning what are the cause. Maybe my patient has a fever because of rheumatic fever, heart disease. Or maybe my patient has a glomerulonephritis and patient admitted because of fever. Maybe my patient has tonsillitis and they have a fever. But we need some laboratory test what doctor should do. But I receive the patient, take the history. I found patient a fever for 10 days. It is nursing diagnosis. Patient got hospitalized because of fever. Then I call the physician. Physician come, check, and write some lab result. So on based of lab result, on based of physical exam, doctor can prescribe patient has a rheumatic fever or other underlying cause. This is called doctor's diagnosis. So this is the basic difference between nursing diagnosis and doctor's diagnosis. Here a question about the analysis. The nurse planned care for a client diagnosed with an acute myocardial infarction, right? And appropriate nursing diagnosis is decrease the cardiac output secondary to which of the following. So the nurse planned care, the client is diagnosed. So your patient was diagnosed already, known case of MI, acute myocardial infarction. So this question comes in appropriate nursing diagnosis is decrease the cardiac output secondary to which of the following: ventricular dysfunction, congestive heart failure, and recurrent myocardial infarction and hypertensive crisis. These to answer this question, you do not need that much experience. Why? Appropriate nursing diagnosis decrease the cardiac output. So this is the mechanism of or pathophysiology, right? Number 3, And number 4 is a disease name, hypertension crisis, MI, and congestive heart failure. This is the disease. But I said this question about the pathophysiology and decrease the cardiac output because ventricular dysfunction. So ventricular dysfunction are the common after MI and reduce the efficiency of the heart. What next? Next here, planning. So during the planning phase, the nursing process, the nurse can plan for formulated. The steps in planning include assigning the priority in nursing diagnosis, specify goal, identify intervention, identifying expected outcome, and documenting the nursing care plan. So the goals are anticipated response and the client behavior that result from nursing care. Nursing goals are the client-centered and measurable, and they have established time frame. Expected outcome are steps need to reach a goal, and a resolution of a nursing diagnosis. And there will be multiple expected outcomes for each goal. Expected outcome goals, this nurse planning intervention. Here is one example of the nursing planning. Question: a client comes to the emergency room complaining nausea, vomiting, and severe right upper quadrant pain. His body temperature 101 Fahrenheit or 38.5 degrees Celsius, and abdominal X-ray reveal an enlarged gallbladder, and he is scheduled for surgery. Which of the following actions should the nurse take first? So this is the clinical scenario. Body temperature raise means patient has a fever because of infection. Patient has nausea, vomiting, and severe upper quadrant pain. Right upper quadrant pain means what are the organs in right upper quadrant? You can answer me: the liver, also the gallbladder. In X-ray, we can see the gallbladder is inflamed because it is enlarged because of inflammation. Maybe inflammation because of the stone inside the gallbladder, and doctor decide to cut and remove the stone, and patient need for surgical operation. So in this condition, which of the following out of 4 assess the client's need for dietary teaching, evaluate the client fluid and electrolyte status? So when a patient is scheduled for surgical operation, they may be nothing by mouth. In that scenario, or before or prepare a patient for surgical operation, we must check the sodium level, potassium level, calcium level, and other electrolyte. So evaluate the client fluid and electrolyte status. If all is normal, means they are fit for surgical operation. And examine the client health history for allergy and antibiotics. So number 3, we already done at the very beginning stage, assessment level. not in this level. Determine whether the client has signed consent of the site. It is also important to sign, but measure or first priorities is the evaluate. And number 4 is the procedure. You must follow this one. Hypokalemia or hypomagnesemia commonly occur after repeated vomiting, and also patient has a vomiting history. Is another cause. We have to check the electrolyte balance. So if I do the vomiting or diarrhea, it is easy to too much electrode passing or loose. I need to check. Now next is implementation. Implementation is the term used to describe the action that you take in care of your client, or implementation include assisting in the performance of activity of daily living, shortly called ADL, counseling and education the client and family, giving care of the client, and also supervising and evaluating the work of other members of the healthcare team. It is important for you to remember that the nursing intervention may be independent action that are within the scope of nursing practice or do not require supervision by others. Depend action based on written order or a physician. Also, interdependent action share with other member of the healthcare team. Now, a question comes about the implementation. A client is being treated in the burn unit for second and third degree burn. Over 45% body involved. So we have to follow the rule of 9 to count down the percentage of body tissue get involved. The physician order includes the application of silver sulfur diazine cream. The best way for the nurse to apply this medication is to use which of the following, right? So when a patient comes to hospital because of burn, it is important to give them the ointment to prevent the fluid loss, right? So burn assessment is important. And there's so many causes of burn, maybe thermal, electrical, chemical, or radiation. But we have to count down the percentage of burn. We call burn assessment. We have to follow the rule of 9. I have explained any other day what is the rule of 9, but here always keep in mind, we have to go for the goal for care a burn patient. Keep it note, it is good to know pain relief until the vital signs are stable. Very important. And priorities maintain the patient airway in burn patient and may require intubation or supplementation oxygen. And also we give the treatment to prevent or correct hypovolemic shock. We monitor vital sign. Also, we insert the large bore angiocath if need, or Parkland formula for fluid replacement, antibiotics, or admin the blood and blood product, and we strictly maintain input-output. This is basic things for the patient. But this question comes about the silver sulfur diazine cream, which is the best one. Sterile gauze, sterile 4 to 4 dissing shock, the saline, and sterile tongue depressor, or sterile gloves hands, and sterile cotton trap applicator. So we need all, but which one is the first priorities, right? Sterile gloves, first of all, because hand washing and gloves can reduce 95% infection. So a sterile gloves hand will cause least amount of trauma to the tissue and also will decrease the chance of breaking blister and prevent the infection. The priority is the infection. And now go for evaluation. Evaluation measures the client response to nursing intervention and indicate the client's progress towards achieving the goal established in the care plan. You compare the observed result to expected outcome. Question about evaluation. When caring for a client with anorexia nervosa, which of the following observation indicate to the nurse at the client condition? So this question comes anorexia nervosa. So anorexia nervosa and bulimia is most important for NCLEX board, and we have to know what are the compare and contrast of anorexia nervosa and bulimia. So basically they said the client eat all food on her meal. So observe indicate the nurse that the client condition is improving. The client eat all food. The client asks the friend, bringing her special food, and also they said the client wet herself daily, and the client weight has increased. So anorexia nervosa, basically patient lack of appetite or loss of appetite. When anybody loss of appetite for the food, means they do not eat. If you do not eat, your body weight is supposed to go down. But when you under the treatment and you eating enough, your body weight will be increased. Anorexia nervosa, an emotional disorder. It is characterized by an obsession or obsessive desire to lose weight by refusing to eat. But when patients under treatment, when they eat enough, their body weight increase. So client body weight has increased, indicate your patient is going become okay. The client weight is the most objective outcomes measure in evaluating a client problem. So evaluation is the last steps of nursing process.